Distinguished delegates, honorable representatives, colleagues, Medical Impact is a non-governmental, non-profit organization delivering humanitarian medical assistance to populations living in extreme marginalization, hard-to-reach settings, and post-disaster context across multiple countries. Alongside direct clinical care, we conduct applied research and engage in health diplomacy, advocating before parliamentarians, heads of state, and the international community to translate frontline medical evidence into policy. From this work, one reality is clear. Women's access to physical health, mental health, and social services is not a complementary social concern. It is a structural determinant of justice, peace building, and public health and sustainable development. Within the framework of CSW70 and the implementation of the 2030 Agenda, it is foundational to achieving SDG 3, 5, 10, and 16. Across context of armed conflict, organized violence, forced displacement, and structural inequality, women experience trauma at a disproportionately higher rates. Gender-based violence, coercion, caregiving burdens, and systemic discrimination directly shape health outcomes and women's capacity to engage with justice systems. Where institutional responses rely exclusively on punitive or exclusionary and prohibitionist approaches, harm is compounded and access to protection and remedies is weakened. Health NGOs are therefore a critical pillar in addressing violence against women, as we are often the first and sometimes the only institutions to witness its physical and psychological consequences long before survivors reach. Evidence shows that when harm reduction is integrated into trauma-informed and gender-responsive framework, it is inspired by pragmatism rather than dogma. Women are more likely to seek support, remain connected to services, and engage with institutions, strengthening access to justice, institutional legitimacy, and long-term peace. At Medical Impact, we affirm that mental health, harm reduction, and access to justice and peace building are inseparable policy domains. Protecting women's well-being, it is not discretionary. It is a legal, institutional, and moral obligation. Without it, justice remains inaccessible, peace fragile, and development unsustainable. Thank you.
I'm Alexia Cortez. Soy una mujer.
I'm a Mexican woman, and it is a great pleasure to be here representing Latin American women. My presentation will be in English.
You see, because guarantee access to health, including mental health and psychological support without discrimination. This obligation requires states to actively adopt measures that ensure the availability and accessibility of health services, particularly for those in situations of heightened vulnerability. In practice, punitive approaches or prohibition-based legal and policy frameworks have a regressive impact on women in vulnerable contexts, resulting in discriminatory justice outcomes as harm as it's not disturbed equally. Women exposed to transversal and intersecting vulnerabilities such as low economic position, limited access to education, precarious or informal employment, low or unstable income, gender-based discrimination, racial or ethnic marginalization, age-related dependency, migration, or displacement status, covering responsibilities, prior exposure to violence, mental health conditions, or disability are the most affected. These intersecting factors deepen exclusion for health and justice systems. From a public security and prevention perspective, harm reduction must be understood as a state obligation derived from the right to health, equity, and the duty to prevent foreseeable harm. When institutional responses rely exclusively on punitive or exclusionary measures, harm is displaced rather than reduced. Women in vulnerable contexts are pushed away from health services, social protection mechanisms, and legal institutions, increasing exposure to exploitation, coercion, and cycles of violence. This weakens crime prevention efforts, undermines institutional legitimacy, and restricts access to justice for women and girls. States face a clear legal choice: to rely on punitive and prohibition-based approaches, or to guarantee effective access to health for women, particularly those in situations of heightened vulnerability. This choice requires a proportionality assessment in accordance with the pro persona principle, which obligates states to adopt the interpretation and application of norms that provides the broadest protections of fundamental human rights. Where restrictive or punitive measures produce foreseeable harm, states must prioritize the protection of right to health as a superior legal interest. Health must prevail over punitive objectives, especially when the latter deepen exclusion and increases risk.